Good morning. I'd like to welcome you to the Tuesday, July 7th, 2020 Reno County Commission meeting. Bob Bush is not with us today. He's having a medical procedure. We're thinking of him certainly at this point in time. If at this point we would rise for our Pledge of Allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. As part of my comments this morning, as chairman, we do have another person from the district attorney's office here today, Assistant District Attorney Andrew Davidson. Would you come up, Andrew? And what we've been having the staff of the district attorney's office is introduce themselves, tell a little bit about your background, where you went to law school, et cetera, and how long you've been with our district attorney's office, and then your daily duties at the office,
sir.
Please.
My name is Andrew Davidson. I grew up here in Hutchinson, went to Buehler High School. After that, went to KU, got a degree in history, and then went to Washburn for law school. After that, I was in private practice for about 4 years, and then I went to prosecute in McPherson County, and I was there for 2 years until there was an opening in this office. So I've been here since 2011. Started out doing the traffic, DUIs and things, all the first appearances, and moved into drug prosecution for a little while. And now I handle most of the person felony cases like robberies, burglaries, aggravated batteries, domestic batteries. My major duties involve those types of cases. I've been doing that for a couple of years, since like 2018, I believe. So most of the cases I deal with are generally the battery type of situations and burglaries.
I see. Is Tom Statton a good person to work for?
As he stands back there.
Yes, he is.
Yeah, I want you to note he's standing back.
Yeah, we were just discussing how good of a boss he was.
or maybe he came down to make sure you said the right things about him. I don't know. So, well, we appreciate you being here, and thank you for working for Reno County and our district attorney's office. Thank you very much.
Yes, sir.
Thank you, and I'm glad to have met you in person.
Okay, at this point in time, we have our COVID-19 update from our Health Department Director, Nick Baldetti, and Emergency Manager Director, Adam Warshauer. And Adam, I need to apologize to you because last week we got so involved in discussion and what was going on that you didn't get your time. So if you want extra time today, you can have it. Okay.
He's real torn up about it. Good morning, Commissioners. Nick Baldetti, Director, Health Department, appointed Health Officer for Reno County. Very quickly, the sit rep for this morning. As a nation, the United States is at 2,938,750 cases in total since this event, COVID-19, has began. Registered 130,310 fatalities associated with COVID-19. There's activity surrounding us in our sister states that we share boundaries with. Very quickly, Colorado has 34,240 cases with 1,691 fatalities. Nebraska has 20,046 cases with 283 fatalities. State of Oklahoma has 16,362 cases with 399 fatalities. And Missouri has 24,211 cases with 1,051 fatalities. Yesterday, the state, Kansas Department of Health and Environment, updated the state's activity from over the weekend. We, as a state, added about 1,000 new cases So we're at 16,901 positives in total. 1,235 of those have required hospitalization, and we've registered 280 fatalities associated with COVID-19. As a county, we also had an active weekend in terms of COVID. We've tested 2,969 constituents with 2,880 negatives. We currently have 89 positives in total since this has began, with 62 recovered, which leaves us with 27 active cases as of today. Our positive testing rate has climbed steadily over the last week. We're now at 3% for positive testing rate, which I think you've heard me say that kind of a 3% threshold was what I was looking at. It's not a trigger, so to speak, but it's just something that I've been monitoring. But we're there. We're at 3%, and then in total we've tested 4.72% of our population so far. A couple things I wanted to speak to, and I spoke to briefly on the call this morning as well, is that there's some misunderstanding in terms of the testing numbers themselves. There seems to be an assumption that individuals are tested over and over and over again until if they test positive, they continue to be tested until they're negative, and that simply isn't the case. If an individual is tested and they test positive, they're quarantined for 14 days post-symptoms. So if they present no symptoms but they test positive, then they simply quarantine for 14 days. If they're sick and they go get tested and they test positive, that 14-day quarantine doesn't start until their symptoms pass. They're still quarantined when they have symptoms, but the 14-day clock, so to speak, doesn't start until they no longer have symptoms. Those individuals are not tested repeatedly to get negatives. Again, there is validity to the fact that the nasopharyngeal swabs can both pick up active viral body as well as latent viral bodies even after somebody has recovered. Additionally, we don't test negative people over and over and over again. We really only test if they present symptoms or if they have an extremely high-risk exposure. If somebody tests negative, we don't test them again unless they present some sort of symptoms or they get put into a situation where they have a high-risk exposure and they have a job that has a high risk of spread, so to speak, with different industries. The second thing I wanted to speak to, I didn't speak as much on the call as I will to you as a board, but we're seeing a significant uptick in terms of the cases that we're bringing forward in terms of actives. Now, this is a reminder that currently it's taking about 5 to 7 days to get test results back when somebody is tested right now. In addition to that, the standard incubation period for the viral body itself within an individual is 14 days. So essentially, I'm not even taking into account the time lag in terms of the reporting from the lab, but simply the positives that we get today are essentially from activity from 14 days plus ago, if that makes sense. So the activity that we're seeing, at least what we have seen over the weekend and into yesterday, we're on a steady incline. Just to the last 7 days, on June 30th, I'm just going to give you the active cases. On June 30th, we had 6 active cases, and then on the 1st of July, we had 9. The 2nd, we had 16. The 3rd, we had 17. The 4th, we had 21. The 5th, we had 26. And the 6th, we had 27. Now, we had cases get deemed recovered in there as well, but on average, we're receiving about 5 to 6 new positive cases a day over the last 4 days. That's a significant uptick in terms of what we have been doing, or we have been seeing in our community. Additionally, I've been in contact with the hospital all weekend. They've been seeing significant amount of traffic come through. Chuck Welch, vice president of, represents the hospital. On our calls this morning, the hospital had a census of 74 total patients. They had 11 awaiting test results, and they had 5 positive COVID patients. He made a comment of, we had that phenomenon of the Saharan dust, and he likened some of the upper respiratory type presentations that they were having in the hospital to that event as well. But it also, I think, is it's a precursor to potentially what we might be looking at in the fall in terms of upper respiratory infections such as our common cold, rhinovirus, influenza as we move into the fall, which is really going to tax our healthcare system because we can't differentiate just from eyeballing somebody whether they have COVID-19 or if they have another upper respiratory illness. And I think the activity that our hospital was seeing over the weekend is kind of represents some of the challenges that we're potentially staring down the barrel at. With that, I simply want to make sure that the board is aware that from a public health perspective, the activity that we're seeing if we continue on this curve, I think is concerning. I think if we see this trend persist through this week, I most likely will be asking to have a conversation as the Board of Health in regard to what the Board of Health's direction and expectations would be in collaboration with health protocols for our community. I guess the last statement I would say, and then I definitely want to make sure Adam has his time, is that, again, and I've said this over and over again, and I feel like the board stated it last Friday or Thursday, it is imperative that we as a community and as individuals take heed to the fundamental public health practices of social distancing, proper hygiene, mask use in public, as not a measure to protect oneself solely, but to protect everyone around us in our community. That's what it's about. It's about caring about each other. And we are on a growth trend right now that is not looking good. And so my hope is that I'm calling upon Reno County constituents to set aside any kind of ideologies that they might have that are feeding into their rationale for perhaps not adhering to these fundamental practices that are not hard to do, but are extremely important in terms of mitigating the spread. Because if we have the kind of growth that we have right now when we work into the fall, it's going to be very problematic for us, unfortunately. And, it made news, but the state fair made the decision to have the state fair. There's no doubt in my mind that there's going to be activity associated with the state fair. No doubt. And that comes at the precipice of our trying to have our kids in school, too. So we have to have people adhere to fundamental public health guidelines to ensure that we have some semblance of a fall that we recognize. That would be my final comment.
Nick, the 5 positives that are currently in the hospital, to my recollection, that's about as many positives in the hospital as we've ever had, is it not?
That meets our peak, yeah.
Has there been 5 before?
Mm-hmm.
Okay. Can you speak a little bit about our adjoining counties, what they're seeing?
Yeah, so Sedgwick County, McPherson County, they're not adjoining, but Saline County, Harvey County, just to name a few, are steadily increasing as well. The activity is exponentially growing right now surrounding us. South to us in terms of Kingman, Stafford, and even to our west, like Pratt County and the like. They don't tend to have as much activity, and I don't necessarily know the reason why, but anecdotally, I don't know if they have the same testing capacity that our community has, or others do. But that's simply, again, hearsay. I've anecdotally I've heard that, but I haven't been able to substantiate that.
Why has testing time for results declined? In other words, you just said that your tests are taking 5 days to get the results back. That's longer than you were telling us before.
Yeah, so at the height of this, I shouldn't say at the height, at the beginning of this, the 5 to 7 days was kind of what we were grown accustomed to. And then as laboratory capacity at the state level and in the private labs ramped up, we were able to bring that time lag down to about 1 to 2 days. Pretty rapid turnaround, comparatively speaking. What I don't know is I don't have a reasoning why in the lull that that capacity seemingly hasn't been continued to grow, or wasn't invested in, as you know, essentially that lull that we had was associated with the statewide shutdown that we had. So I don't know why necessarily from a capital and logistics perspective, Commissioner, but what I can say is that the lag is that I think we're seeing a strong infusion of cases throughout the state, and the demand on the laboratory facilities with the same capacity that we were working with at the quote-unquote height before we began to see a lull in activity.
I read this morning in the paper, so maybe you can expound on this a little bit, and so we can get some clarity directly
Sure.
from you. Regarding the tick situation that we have here and the occurrence versus of anaplasmosis with some of the same symptoms. While I realize that most of the time anaplasmosis is very, very minute.
Right.
But could you expound just a little bit on that potential testing for that as well? Or
Yeah.
does that can be done here locally, or does it?
Yeah, it can. It's a blood draw.
Okay.
So any one of our medical facilities will be able to test for that. The biggest thing is that obviously we're in the height of the summer, and it's also the height of tick season. As you're conducting activities outside, it's just important that you take precautions, wear long sleeves. Certain repellents will try to detract ticks as well, but it's also important that if you live out in the country, or if you go to one of our state parks or what have you, that if you do have activity, that you scan yourself and your loved ones for any ticks that you might have picked up and remove those, and then monitor those quote unquote those bites closely to make sure there's no presentation of everyone knows
Redness.
like the bullseye and the redness associated with those bites.
I know some of those ticks are so very small they're hard to even see.
Yeah. Mm-hmm. Yeah. But yeah, to your specific question, all of our medical institutions will be able to assist.
So that's easily found out.
Mm-hmm.
Okay. Well, thanks for the clarification on that, because I know several people may read that and need a little more clarification on that.
Absolutely.
So I wanted to say I completely agree and expound on the fact of what you said with regard to the 3 items that you really need to pay attention to: social distancing, people distancing, mask wearing, and to clean your hands.
Mm-hmm.
That's going to be the key to the people doing that. Now, I know earlier when we went out over the weekend and so forth, mask wearing, I think, has started back in a little higher in some instances. But it's going to be up to the public to slow this down. Not going to eliminate it, but to slow it down.
The hospital, or I'm sorry, a newspaper article referenced that you made some comments that we're seeing a little bit more of ethnic diversity in the cases. Is there any explanation for that at this time?
I don't have an explanation for you, but what we have seen is increased activity in our Hispanic and Latino population in terms of those presenting and testing positive for COVID-19. But I don't have an explanation at this point. In terms of the data, we've been tracking the racial demographics to see anything, and not until roughly the beginning of last week there wasn't any differentiation, but it's really began to uptick in the Hispanic population.
And that percentage now would be higher than the percentage of that population base?
Yeah.
Now, I want to help clarify something here, Nick. You can actually contact this for a couple or 3 days or so, 5, 7, help me out there, and be contagious to other people, even though you haven't yet shown the symptoms. Is that correct?
You can. That's earlier I spoke to that 14-day incubation. So that's based off of the most recent medical research. We're still adhering to a 14-day expectation of incubation, meaning that if I were to contract it today, I'm really not clear whether I'm going to present symptoms or not until 14 days post-exposure. Okay. Now, in terms of the disease investigation work, what we do is that the height of the shedding potentially so viral shedding, the height of it is if I were to present symptoms today, the height is 2 days back from when I presented symptoms. So if I felt ill today, the highest saturation, which equates to greatest risk of exposure to those that I've been around, would be 2 days from when I was sick or today. So
I think that's important to know. You also mentioned earlier that I think I read this, that should this continue higher, that and you're already facing problems of trying to trace. The governor, I think, was hiring extra people to do assist tracing. Is there any possibility of getting any help that direction so that you don't put such a strain on the health department?
Yeah, we're having, yesterday we had an initial conversation about resource allocation, so we're planning appropriately. What I can say is that in terms of an expectation of 5 to 7 new cases a day, we will be overrun in terms of our capacity to case contract in short order. And so I have emailed KDHE in terms of the case contacting, I call them a fleet, I suppose, that the governor has tried to create for the state. The only, I haven't gotten an answer, so I'm only speaking for myself, but my assumption is that that was put together for much smaller health departments that have far less resources than we are afforded here in Reno County. And so I don't know until I ask, but I'm going to ask KDHE. But also just know that we're planning internally. And so if there is a request contingent upon whatever KDHE says, that I probably will have that conversation with the board as well, with the county administrator.
How long does it take your person that's in charge of case contacting to teach a new person how to do this?
The state has created online training for basic case contact tracing. The challenge that we're seeing is that we really, for the amount of medical questions that we're receiving, it's really more efficient if we have a medically trained individual do the case contact tracing, because people have so many questions that are medically are medically grounded. And so if we were just to simply hire a lay individual to do case contact tracing or reallocate someone who doesn't have a medical background, it would be a really steep learning curve, and we might get into a situation where we simply have someone who has an initial point of contact and they're taking a message to have a clinical person. So that's part of the
So it's your
challenge.
feeling that to do this adequately, you need to be using people within your department that have some medical background.
Or yes, inside the department with a medical background and or have a medical background if we were to look elsewhere. That would be my preference.
Mm-hmm. Sure. Because you're saying otherwise a person might make contact, questions would come up that they'd have to refer to
Mhm.
another person.
Exactly.
Well, I think that, Nick, you need to keep us advised on the number of new cases per day, which I know you will. I think I was very open in my vote last week not to require masks, but if our cases continue to go up at the rate that they have the past few days, I will not hesitate to require mandatory masks. I think we have to protect the community. So keep us advised, and if it's appropriate to have another emergency session of this board, so be it. I'm not sure how soon Bob can be back with us, but I just, at this point, have not heard within the community that people, there seems to be a very large group that is committed to wearing masks in public places, but there seems to be a continuing large group that is not interested, and I think we're going to have to make an impact to that other group if our cases continue to grow. At least that's my feeling at this point. Ron, any comment or?
No, I would hope, and I would trust, maybe that's asking too much, but I really think that between the people understanding this, and I don't know how much more understanding we can put out there, but I think we need probably lots of help with our media and social media to impact upon people the importance of the 3 target areas to protect not only oneself but another one. Just the fact that it can be transmitted 2 days before actual signs of COVID or colds or whatever, anyway, respiratory situations, that could be transmitted. I don't know that everybody understands transmissions, really. I think between the businesses and individuals that we can do this, and I appreciate your stance, Commissioner Sellers, but I feel we can do this without any type of mandatory things that, unfortunately, if we could enforce them and we needed to, we couldn't effectively. If there are known transmission people, they know they have it and they go out in public, by golly, they need to suffer the consequences. That's all I have. I appreciate the update and the knowledge that you've given it to us.
Mm-hmm.
Nick, is there, I've been hearing last week or so that there are some scientists that feel that this virus is actually in the air and is not necessarily all the time transmitted by face-to-face contact.
Mm-hmm.
Would you suggest that they're correct, or do you have any knowledge of what they're speaking about?
I don't necessarily have any direction for the board this morning. I'm monitoring there's a large group of physicians that wrote a letter and petition to the World Health Organization for them to revisit the classification of whether the SARS-CoV-2 virus is aerosolized through droplets or if it's truly airborne. The difference, again, is that aerosolized is through the droplets that are expended through our respiratory cavities, through our mouth and our nose, whereas if it's airborne, to Commissioner Sellers, your statement, it simply stays in the air where you are. That is significantly different than how we have been responding to the previous guidance that it was simply aerosolized through droplets. I just need to follow up more on the research before I give a more concrete answer either way.
Right now, I think we better believe it's the air droplets and moisture droplets.
I think if it shifts to airborne, it will significantly shift the entire response, to be honest.
Okay, if there's no more questions. Randy, do you have any questions of the Health Director?
I don't.
Okay, if not, we're going to hear from Adam Weishire of our Emergency Management Department.
Good morning, Commissioners. Adam Weiss, our Emergency Management Director. Just a few things for you this morning. All the way back in March, the Board of County Commissioners declared a public health emergency. We're still under that public health emergency. It got extended back in May. It's set to expire on July 17th. So we'll be back in front of you next week again. We'll ask for another extension on that. And it's we can extend it for another 60 days or however long the commission chooses. There's no set time limit on it or time restrictions. You can make it as short or as long as you want, or you could say till the end of COVID, and you would just have to come back into session and say that you're ending that public health emergency as well. So it depends on, there's several counties, obviously, and they all do it a little differently, so it's just however the commission wants to do it. Currently, statewide, there's 100 counties that have an active public health emergency in place, and what that really does for us right now is it allows us to request resources from the state. Some of the resources that we've received from the state and pushed out to organizations include 225,000 masks, 38,000 disposable gowns, 15,000 face shields, and in excess of 40,000 gloves. Currently on order through the state, we have over 200,000 masks, 60,000 gowns, 15,000 face shields, and also some COVID test kits. So we've provided COVID test kits to our jails, to our jail, to our hospital, to our clinics, and all that stuff gets ordered through my office. And then the health department actually distributed approximately 150,000 masks and 30,000 gowns last week. So there's a ton of resources coming in and coming out, and it's a lot of boxes. So what we have on order is about 1,000 boxes, if that tells you anything. There's 97 counties right now that have cases. So that means that there's only 8 counties in Kansas that don't have active COVID-19 cases. And then we continue to work on our PPE distribution and inventory and resource requests on a daily basis. But that information is due to the state on Wednesday. So it's a pretty big undertaking, not only to get resources in and out, but also to acquire accurate burn rates from every organization across Reno County. So I think that's all I have for you this morning. Do you have any questions for me?
I was reading something, so if I missed it, I apologize. How much activity in your PPP are you having by businesses requesting PPP? PPE?
PPE.
PPE.
And that would be something.
I guess I was talking about loans. Wasn't I?
It's all the acronyms.
Do you do loans?
I don't do loans.
You don't do loans.
So I know the health department had an excess of 100 requests. That's a combination between businesses, venues, hospitals, clinics, schools, etc. So I haven't broken those out between private businesses and government organizations or schools, but there's been a lot of requests.
Okay.
Does, I read this morning, I think it was this morning or yesterday, where the Civil Air Patrol was helping deliver some.
So the Civil Air Patrol on the 4th of July, the hospital needed the drug remdesivir, and there was an emergency request put in. And what happened with that was the Civil Air Patrol put it in the airplane, flew it to the airport. We met them at the airport, and then delivered it to the hospital directly to the pharmacy, so they could get that to the person in need.
Okay.
So they'll deliver that as needed.
That's good for them.
Okay, thank you.
Thank you.
We take quite a bit of time each week in our meetings for our update from Health Department and Emergency Management, but I think not only we as county commissioners and county administrator are interested in this, but I think the public is very interested in this, and I know significant public listens to our meetings, so I think it's very important that we have as good an update as we can. Okay, at this point in time, we're ready for public comment on items not on the agenda. Anybody outside today? Okay, that kind of surprises me. As many emails as the commission got on for or against masks, it surprises me very greatly that the public doesn't want to comment at this point in time. If not, we'll move on to any additions or revisions to the agenda. Do you have any, Commissioner
I don't really
Hurst?
have any, but I have a question. Is there any need to wait on this emergency order? Or shall we wait till, is there any addition, do we need to make any changes, or should we just get into this now and extend it, say, till October 1st, some date forward?
Okay, is that a question to Adam?
Yes.
The only change would be there would have to be a new resolution drafted, and it would just basically change the date at the bottom. So there wouldn't be any major undertaking. It would just be a new resolution.
Maybe ask the counselor that.
Would you rephrase the question for me?
Is there any need to put off until next week the extension of the emergency order, or can we just dispense with that now and extend it to a later date?
I think I agree with Adam. I think that needs to be a written extension of that.
Okay.
Yes, and
All right.
I can have that.
All right.
Yes.
Commissioner Hurst, are you surprised that the county counselor thought that we should have something in writing to do that?
Not really, but I thought I'd just bring it up anyway.
You tried to sneak that by.
I saw his eyes go up, if that's anything Commissioner Sellers.
Okay, do you have any other items
No, I
for the
don't
agenda? County Administrator, any additions or items?
No.
Okay. If not, the agenda is approved as written. The consent agenda. There are 4 items on the consent agenda. Vouchers in the amount of $619,415.42. Resolution 2020-18, which is the Coronavirus Relief Fund, CARES Act. Resolution 2020-19, giving authorization to Brenda Coates, Elizabeth Bellevue, and Randy Partington execute bank transactions in the state of Kansas Municipal Investment Pool. And item D, Fire District Number 9's purchase of a 1995 Freightliner fire pumper truck from Reno County Joint Fire District Number 1 for $32,000. Commissioner Hurst, is there any items of this on this group that you'd like to be discussed individually?
I have none.
Saying that there are none that you want discussed, would you make a motion, please?
I would. I move to approve the consent agenda as read by Commissioner Sellers and presented by staff.
I will second that motion. Clerk, would you please call the roll?
Commissioner Hurst.
Yes.
Commissioner Sellers.
Yes. Moving on to discussion and action items on the agenda. Our item A is outsourcing the production and mailing of approximately 45,000 tax statements. I believe County Treasurer Brenda Coates is going to present that item. Brenda, we've read the information that you've sent to us, so.
Basically, if you will look at the costs of what it cost us to produce those tax statements, I believe I have a total on yours of $18,755.75. That does not include any labor costs or time out of the treasurer's office. It does include some time out of the clerk's office because we are dependent on the clerk's office to fold the statements, stuff them, and get the postage put on them. And they're sorted. So we are setting at that amount, and if you look at the bids that I got in, and they all have figures that say they will not go above, will not exceed certain amounts. I have a sample of one, and I am recommending the Master's Touch. They're at $19,000. So essentially, we are probably going to, if you want to put our time in the treasurer's office for what it takes us to print off things and actually produce these statements themselves, it's lower to have Master's Touch produce these statements. That's what they do for a living. That's their business. They can have these statements out the door in 2 days. Us, we're 3 to 4 weeks. There is another county that used Master's Touch. A very professional looking statement. Everybody in that county complimented them and said they were easier to read. I can pass it around if you would like to see them.
That's okay, fine. It's very attractive.
Yes.
Does it have all the information that you used to put on the statements?
Yes. And on the back side, it also has everything that the state requires. They print front and back. They will also, what I have seen happening is we send out all of our statements and people have failed to tell us that they have moved or something. And we get back anywhere from 7 to 8 big cardboard boxes full of returned mail. These companies, and then of course that costs us to send them back out if we send the statements back out again. This company will use a service through the post office that checks for any revised addresses and stuff.
Yeah.
And they are saying that that should drastically reduce the amount of returned mail. So that's an additional savings that we don't have if we're doing it.
I believe in past experience that you can put a statement on your envelopes that also will help that. That they send that back to you. That way you don't have to hunt and find. I can't remember the exact wording, but you probably know
Return
it.
service.
Yeah, return service requested. Yeah.
Okay, is there a motion to accept the treasurer's request to outsource per her document?
I would move to approve the outsourcing of tax statements to Master's Touch
Yes, sir.
at a cost not to exceed $19,000.
I will second that. Please call the roll.
Commissioner Hurst.
Yes.
Commissioner Summers.
Yes. Thank you.
Thank you.
It wasn't too bad, was it, Brenda?
No, that wasn't too bad
Okay.
at all.
Well, come back and see us again.
Oh.
Okay. When you're not spending money. Okay, the next item on the agenda is architectural services by GLMV Architecture for courthouse exterior weatherization and courthouse interior exterior earthquake damage repairs. Harlan Depew, please.
Harlan Depew, Maintenance and Purchasing Director. We discussed this in quite a bit of detail 3 weeks ago, and took a little bit of time to get the final contract for the plaster scope of work ready to go. But what you have before you are the three separate contracts with GLMV for the courthouse weatherization project, the exterior earthquake repairs, and then the interior plaster repairs also from earthquake damage. I should mention, I noticed this morning that the little spreadsheet that was stuck in your packet that had the totals, the interior plaster repair amount was incorrect on that. I'm not sure how that happened, but the cover sheet on the agenda item is correct. And so, I guess, do you have any questions?
Okay, you feel like you were doing some negotiating with GLMV to an appropriate amount for their fees. You feel like at this point in time that you can recommend this, Harlan?
I do. The fees are on a percentage basis. They are higher than what we're accustomed to paying. But this is not a run-of-the-mill kind of a project either. There's a lot of additional expense, especially on the earthquake repair component for the exterior from engineers and other consultants that the architect is paying for assistance and consultation on this project. So I believe that's why that's high. And so yes, I do feel like this is the way to go at this time.
Commissioner Sellers, I did inquire a little bit and bothered him while he was on vacation with the fact that I hadn't done my 2 or 3 weeks ago, hadn't really paid enough attention and done my percentages. So I inquired about the high cost of the architectural fees. I'm used to a little smaller, quite a bit smaller amount, quite frankly. But I would ask one question, and I believe Harlan answered that sufficiently with where I'm not happy, but I'm satisfied. Okay. But I would question why $7,000 for architectural fees on interior plaster repair.
That's the one I mentioned was incorrect on that spreadsheet. It's actually, if you look at your agenda memo, the front page, on that one lists it correctly at $45,000 plus $2,500 for interior for reimbursable expenses. So $47,500 is the amount on the plaster repair.
Okay, I was looking here.
Yeah.
At the, and I just, thank you. Yeah, I understand the extra and carefulness of getting the earthquake repairs done to a satisfactory level, that when we see, hopefully we don't see it, but we get another 4.2, that those will be done sufficiently to not cause such expenses again for our insurance company, that will reflect back on our fees later on. So I would move to approve the architectural services by GLMV Architecture for the courthouse exterior weatherization and courthouse interior exterior earthquake damage repairs as presented by Harlan.
Okay, I will second that. As a question to that motion, has the county administrator reviewed these and support these documents?
Yes, I have, and I do support them.
Okay, I have no further questions.
You bring that's a good question there, because we talked about partial payments, so it wouldn't as construction went along.
Yes, sir. As I contacted our adjuster and asked that question, and as I understood his response, once the bids are in and approved and accepted and reviewed by the insurance company, at that point they will go ahead and forward the proceeds for this claim, the major part of it up front. And then once the work is completed, then they would finish out the remaining, kind of like a retainage amount. But yeah, so we should have the funds really prior to actually getting the invoices in.
And
from
the adjuster has
contractors.
seen all these amounts and
Yes.
has approved.
They've reviewed these contracts as well.
Okay, one more question. Did we do the temporary repairs early this spring that you felt
Yes.
like were needed? And how did that project go?
It did what it needed to do. We actually had those completed in the end of November and into December of last year, as I recall. It was
Okay.
before the end of the year.
I did not know it was that early.
Yeah, and so it did eliminate the vast majority of water, getting in through the dome over the winter time, which was really what the what the intent was.
And this project includes some kind of interior structure that better holds those blocks on at the top of the courthouse.
There's a steel truss system that supports the roof over the top of the dome area. That steel structure will remain, but it will be reinforced with additional steel bracing to stiffen it up to where it should hold up a lot better if we have additional
You
shaking
use the
going
word
on.
should instead of will.
I use the word should.
Okay. Okay.
The engineer is confident that with these reinforcements that it would handle earthquakes, at least a few additional earthquakes in the same range that we've had. If they get a lot stronger than that, I suppose all bets are off. But
And I think we discussed 2 weeks ago when you were here that these bids will go out all at one time, assuming and hoping that we get one contractor. Will
Yes.
it be one bid, or is there separate bids?
it will be separate bids, and the reason for that is because of the insurance
Part of it.
portion of it. We need to keep those separate and clearly delineated within that
Okay.
process.
Okay. Well, I think you've done a good job on this. If there's no further questions, clerk, please call the roll.
Commissioner Hurst,
Yes.
Commissioner Sellers,
Yes.
Thank you.
Okay, item C, I see Renee in the room, is revisions to 7 personnel policies that the Personnel Department has made. Welcome, Renee.
Good morning.
I have read those. I know that Commissioner Hurst has, because he gets ready for these meetings very, very well and thoroughly. I have no questions relating to those.
I do not.
I don't know that we need to go through them individually.
I agree, and I appreciated that. I did realize this morning there is one, and looking at the agenda request, there is an item I probably should call your attention to and note for the employee, that just
Okay.
in one policy that should probably outline a little bit better.
Okay. And what is that?
This is on the personal leave time policy.
Mhm.
On the first page, it's under the paragraph entitled accrual process. The last sentence states employees will not accrue the full accrual rate of pay in periods which do not periods that include leave without pay. That is a change that was not outlined on here, but will make a difference to a handful of employees. It's not very often this happens, but for example, current eligible full-time employees accrue personal leave time based on their years of service. So a 5-year employee earns 4.32 hours per pay period. Part-time employees earn accrued time based on the hours that they work, that they're assigned to work, 32 hours, 24 hours, and such. In both combinations, they accrue leave time based on not only the hours worked that period, but also any accrued paid time off that's been approved. So they could work 20 hours and have 20 hours of PLT or sick. There's still 40 hours of posted time there. What this is going to change is that there are situations where employees work without pay. For whatever reason, they have either used up all of their accrued time and they still want additional time off, or there could be a situation where we tell someone you are in administrative suspension. You're going to have some time off without pay, this full week, partial week, whatever. In instances like that, what we would like to do is to align the policies between full and part-time, that for a full-time employee, they're not going to earn that 4.32 hours or whatever that rate is that they're currently assigned. At the full rate, they're going to earn it at a percentage of that rate, just like part-time is. So they're not basically going to be allowed to accrue a full benefit when they have not earned it by those hours. So basically, in a long short here is that we want the full-time calculated based on hours posted that does not include work time, without pay time. We will always have employees that there's a situation, maybe an emergency situation or unforeseen circumstances that's serious, that they need to have some time off without pay. We will always look at those situations, review those under family medical leave, ADA, grant that time off whenever we can. It's just that we feel that to earn the full benefit of those hours should be based on that they're following the policy and working the time or using already accrued paid time off. Does that make sense?
Mm-hmm.
So that's the only difference in that policy.
I think the important part here is if it makes sense to you and the county administrator.
Yeah, I did have
I
Joe.
plead that it's not important, as important for me to understand as you and the county administrator.
We did have
understand.
county council review, department heads, and benefits committee went all of them over them in advance. So it's not a surprise to any of those people. So.
Okay.
After sitting in on one or two of the sessions at the Kansas Association of Counties regarding HR, I'm glad we have professional people who really can acknowledge all the rules and regulations.
A lot to it sometimes.
Is there a motion to approve these changes? I believe there's 7 changes to personnel policies.
I would move to approve the revisions to the following 7 policies as presented by staff.
I will second that. Is there any discussion? Randy, you've approved these?
I have read them and agree with them, yes.
Okay. Staff, or please call the roll.
Commissioner Hurst,
Yes.
Commissioner Summers,
Yes. Okay, item D is coronavirus relief fund discussion. County Administrator, you want to present this?
They're all-
Thank you, Renee.
The coronavirus relief fund discussion is going to be on the agenda every week for a while. And with that CARES Act money, that $12.6 million, one of the caveats or the intentions is all decisions related to discussion about the funds and how Reno County is going to spend those and disperse those need to be in public settings. So we are just going to put it on the agenda for each week. There's not a lot for this week. Based on the motion last week to allow me to work with a couple consultants, Reno County will, and I'm working with Joe to get the agreement contract in place, but they've already started working it, and that is Gary Meager, the former Reno County Administrator, and John Deardoff, the former Hutchinson City Manager. And they're working together with me and creating a task force. So I'm, in fact, meeting with them later this morning, and then probably again later this week to start building a task force that will then get together to discuss not only reimbursements for COVID-19 related expenses, but a direct aid plan. And that's really more for the discussion of what's needed in the near future and long term for public entities, which include all cities in Reno County itself, the organization, and all public school districts in Reno County. Kind of what they need to be purchasing or a plan to better prepare for the future, the new future with COVID-19 playing a role. So the proposed list of task force members, not individuals, but entities that the consultants sent me during the weekend was to have a Reno County Commissioner on this task force. And we want to keep their task force relatively small, but include a broad range of the entities. Someone from the city of Hutchinson, the Pretty Prairie mayor or city clerk, the Buhler School District and the Haven School District, Hutchinson Community College, and someone representing the health department. So we wanted to keep it relatively small, but we will reach out later this week if you guys are okay with that group of entities to include. That doesn't. I want to make sure that does not exclude other entities. We will still be reaching out to the cities from Turon to Buhler, Nickerson, all the cities, all the school districts, and internally too, to emergency management, the fire districts, everyone that will be impacted with this money. So I wanted to see if there's any questions on this.
I don't know that I have any questions concerning the makeup of that entity, particularly since it's the job, and I'm not sure I want one more job on this county commission, but it's our job to make the final approval of any recommendations that this task force makes.
Right.
So.
And the thought of this was to have a small city,
Sure.
a large city, and then, of course, the same with the school districts.
I see, and
That's kind of how
a large and a small district, school-wise. That's the reason for the two there.
Yes.
Okay, that makes sense.
And the same with
Mm-hmm.
Pretty Prairie and then City of Hutchinson.
Mm-hmm.
If
That makes sense. I'm glad you explained that. I didn't comprehend that when you were listing the group, but
right, it wasn't
mhm.
specifically for an individual we were looking at. It was really the size of the entities,
Right.
trying to really, I guess, represent all of Reno County.
Okay.
Get input from the small as well as the large, and same way with cities, with the school districts. And that's 7, and that's a good-sized committee.
Well, plus 2 people that are the coordinators.
Yes.
So it'd be 9.
Yeah.
Right.
Okay. Give us one more time the timing on all this.
So the timing, there's webinars that start this week, but all the reimbursements are for expenditures from March 2020 through December 30th, or 2020. But all of the information has to be sent into the state of Kansas, the Spark Task Force, for approval by August 15th. So between yesterday, and August 15th, it's going to be very busy getting all the reimbursement information, but also developing a plan for future expenditures. The reimbursements have to qualify in it for COVID-19 related expenses that have not already been paid for with federal monies. The plan is kind of the same. It can't be for anything that's already going to be covered by other federal monies.
Mm-hmm.
And whatever plan that Reno County, the county commission has to approve, goes through the task force, the county commission approves, and then has to go up to the state by August 15th to get approval.
Okay. And be expended by?
December 30th.
The expenditures other than the reimbursements for the COVID part, do they outline exactly what those should be, or are they giving us an ability to decide for us ourselves how that is?
It's really to, excuse me, to decide for Reno County what is is considered
And it-
most
it's
effective.
looking to stimulate things happening again, is that?
There are a couple other phases of this, of the 1.25 billion that the state of Kansas has received. This is just the first phase, is 400 million. So 12.6 comes to Reno County. That's for the public entities. Now there's a phase 2 and phase 3 that's in the same time window by December 30th. That's really to, I think the way I read it is to stimulate the economy a little bit more. So counties working in partnership with businesses in the area to have the economy better.
Okay.
The first part's really for probably infrastructure needs, technology needs, things that are COVID related, or PPE expenditures for the future.
Okay. Do you need an approval of this today, or is this just for information, or you want us to approve the members of this task force?
I would like for you to approve the members of the task force, and I will say for one of the alternates we talked about was if Pretty Prairie, maybe they don't have the time. If, Arlington, the mayor of Arlington was another person that we talked about including. So,
Yeah, I think that's a good alternative there with Arlington. Well, I would move to approve the makeup of the COVID-19 enhancement program, or what is the official
the Reno
name?
County COVID-19 task force.
Task
Yeah.
force, okay, of one commissioner, the administrator, a member from Hutchinson City, a member from Pretty Prairie, or as an alternative, Arlington, and from the Buhler School District, from the Haven School District, and Junior College, as well as approve the two consultants, which are,
Did you include
Gary.
the health department?
oh, I missed the health
The
department.
Reno
I'm sorry.
County Health Department, yes.
I'm sorry, I missed that. Health department.
Okay, I would second that motion. If there's no further discussion, please call the roll.
Commissioner Hurst,
Yes.
Commissioner Sellers,
Yes. Okay, next item on the agenda is the county administrator's report for today. Randy, I think you have a few items for that.
Okay. Just to let you know, the COVID-19 CDBG CV grant, we received 14 applications. 9 of them are actually inside the city of Hutchinson corporate boundaries. And we're waiting on SCED for the final list of qualified applicants as they've looked at the applications before a task force looks at the applications. We're also looking for, I guess, an opinion of whether we can or can't give the grant money to businesses that are inside the city of Hutchinson, since the city of Hutchinson also has a grant. That, because they are a part of
And who
Reno
will-
County, but we don't know.
Who
if
will
it's-
make that determination,
We're-
Skid?
The state of Kansas
State of
will
Kansas?
explain their
So that'll
grant
become
guidelines.
any hour now, won't it? Become quickly that ruling. Well, you know, originally I understood why the city got money and for city businesses, and the county got money for businesses outside the city. But if we have applicants that are inside the city, I hope they give us permission to allocate to them as part of our grant, because obviously 60% of our population and 60% of the taxes of Reno County are within the city. So it doesn't bother me at all if they rule that we can give city businesses. Is it you, Ron? Since
I would agree with
since
that.
only 14 have applied, I'm a little disappointed we haven't had more. City didn't have that many applications, and certainly 14 isn't a huge number to.
I think part of that reason I've encountered as I've talked to businesses out there is some of them have already received money from the PPP program,
Not the PPE program.
not the E,
Yeah,
the,
okay.
the P, you know,
Okay.
okay? And so therefore, they were ineligible for this CDBG COVID-19 grant. And so I ran into that, and also saying that we just take care of ourselves. But that's the two primary reasons I think that, especially the PPP program.
Okay, and did we get a group to put together to review these applications?
We discussed it, but I have not contacted the group yet.
Okay.
I think you had given me a couple, Commissioner Sellers, you gave me a couple names, Commissioner
gave me
Hurst,
one.
I think you gave me a name. I just haven't contacted them yet until we get all the applications in.
Okay.
And they were due last Friday.
Thursday,
Thursday,
right?
excuse me.
And we have time to not appoint this board?
It doesn't have to be today, yeah,
Okay,
the money has to be
Next week.
spent by next year,
next year.
June of next year. I mean, there's time, but obviously for the businesses, they want
So,
probably want the money as quick as
Certainly, if
possible.
we're
Yes.
providing help, we need to get them money now instead of next
So
year.
as soon as we get the applications, hopefully I'll have more information before.
And we
Next
get
week,
the
or-
report back from SCED from, they found out from the state.
Right.
Okay, Randy, do you have other items today?
Yes, I was just gonna give you an update on the 2021 budget schedule. Next week, I was preparing to have a presentation or a discussion with you about how the budget's looking after the discussions we had a couple weeks ago, all the budget requests, re-looking at the numbers, the revenues, expenditures on the state form and how that's looking with the mill levy. Give the commission a couple of options, let you know where things stand, and have a discussion. So July 14th would be the initial proposed budget. At that time, you guys could either give more directions to cut or go back and come back the following week on the 21st or 28th of July. At one of the next couple meetings, when that is presented, you'll need to set the maximum budget. That will then be published in the newspaper to set a public hearing for early August. And then August will be a meeting in August is when you will approve the 2021 budget for the Reno County budget.
So next week, this presentation will actually be an agenda item.
It'll be an agenda item. I'll give an overview, a summary of the 2021 budget and the proposed budget for the maximum budget. And that'll be your chance to decide whether you want to adopt that as the maximum. Because when you set the public hearing, you probably know that you can lower the budget, but you cannot increase it past that time. So,
Okay, thank you. Be looking forward to that. It's certainly one of the most important things that the county commission does yearly. Any other items, Randy?
I passed around kind of a year-to-date total expense budget report just to give you an idea of where we're at on spending. And as a reminder, because of encumbrances and then expenses at the end of the year, that'll be in January, February, maybe even March, expenses that will hit 2020's budget. So it's hard to look at it, 6 months out of 12 for 50%, but that's as a baseline. This is through June 30th. Expenditures in most all departments are either at the level that would be expected or below. Salaries, I think, are the item which aren't listed here that are really right around 50% in most departments. The commodity and contractual and even capital expenditures are usually below 50% right now. So all the departments are watching their spending.
Okay. Commissioner Hurst, do you have items or comments this morning?
No, I don't. I just appreciate all the departments in understanding our financial situation coming up.
Okay, questions that I have, are we any further along on the easements that have to do with solid waste building their new facility?
Yeah, we are, and actually I was hoping I might have an opportunity to address that this morning.
Okay, this is your opportunity.
Okay. Well, I've been working closely with an engineer with SCS on the drafting of the easements and the locations of the easement. There are three of them actually, even though there are only two utilities. But we pretty well had those easements, written easements, and of course the mechanical drawings that depict where they're to be located, prepared to go. And I was going to work on with that in place and agreed to by Evergy and Ideatech, who are the two utilities that are using the Mohawk Road right-of-way right now for those purposes. And this morning I got an email from the engineer indicating he's further working with those utilities, or at least one of them, on burying the cables and the lines rather than above ground. And that would be particularly important since a good portion of the easement that we're providing them goes outside of the existing road right-of-way and goes around the improvements that we're constructing, the scale house and so forth. And to have those buried rather than above ground would certainly be to our advantage. He said it would just take a brief period of time and he would get me revised versions of the easement. So we're very close to that. We don't want to, it won't take us long to take up the matter of vacating the road. I would say probably for the publication requirement and the viewing and the public hearing, probably 6 weeks from the time that you receive the petition. But we want to have those easements available if you vacate the road. We want those easements available for you to sign at that time, conveying these rights to the utilities as a substitute for the easements that they will be losing when the road is vacated. So I would think from what Steve, the engineer, told me that I would have revisions to those easements that we've been drafting and circulating probably back within a week to 10 days easily. So maybe in a couple of weeks we can start the process.
Okay, so Joe, to help me understand the easement situation, currently these two utilities have product on, under, or above Mohawk Road.
Right, that's correct.
And we're going to vacate Mohawk Road, but give them an easement around what we're building.
Part of it will be around what we're building. The south part will be in the same location where it is now.
Okay.
So it comes up from the south, and then it takes a 90-degree angle out into the field and around.
Off of Clark
So
Road.
these
and up to Clark Road.
these changes to their utilities, they do at their expense?
Yes.
Tell me how we have the ability to make them move this stuff.
Because the Kansas statute says that they are in the road right-of-way as a matter of statutory right. That's why they're there. We did not give them an easement in our road right-of-way. By law, any utility, any entity defined as a utility can use the road right-of-way, but it's subject to
And now that the road's not going to be there,
the
they
road
have
isn't
no
going to be
right.
there. And
Okay.
but it says that should we require them to be moved, it's to be done at their expense. That's what the statute says. And I don't find anything directly in the statutes regarding the road being vacated, but it seems to me a matter of equity and fairness that since they were there as a matter
Yeah,
of right.
I'm
if we're
not
taking it-
disagreeing.
yeah.
I was just surprised that it wouldn't be at our cost. And
Right,
you've
in this case,
explained
it's
that.
theirs,
Okay.
right.
Okay. Obviously, the county commission's got a lot going on now. The courthouse remodel, the COVID situation, the budget. Appreciate the hard work of all of our staff and all getting that prepared for the county commission on a weekly basis. It's seems to be more than we've ever had during my term as commissioner. Does Nick have something else to present?
No.
Okay.
It's here for a different reason.
Okay. If there's no other items, I'll adjourn the meeting. Thank you.